Welcome and thank you for attending this important discussion about the COVID-19 vaccines. My name is Laquita Honeysucker and I'm the director of UFCW's Civil Rights and Community Action Department. As I'm sure many of you know, UFCW represents 1.3 million frontline food and retail workers across all 50 states, Puerto Rico, and Canada. Welcome to all of our UFCW members watching tonight. UFCW represents essential workers in grocery stores, meatpacking plants, and so many other frontline businesses that have been critical to keeping our community strong. Getting the COVID-19 vaccine is essential to keeping all of our UFCW members safe on the front lines. This will help us stem the tide of the pandemic and protect both our families and the many communities we serve. We know that our UFCW members have questions about the COVID-19 vaccine, and today's town hall will help to answer your questions. This past year, you courageously stepped up when our communities needed you most, helping to keep your country's food supply chain secure and ensuring all of our families were able to put food on the table during this crisis. From processing meat in dangerous conditions to keeping our grocery stores open, America needed you and you bravely answered the call. Many of our UFCW sisters and brothers were directly impacted by COVID, with 93,300 members getting infected or exposed, and 462 members tragically dying from the virus. The COVID-19 vaccines offer us hope and protection at a time when we need it most, and that's why we're here today. Everyone over the age of 12 are now eligible to receive at least one of the COVID vaccines, with 3 safe and effective vaccines now authorized for use for adults. This is a pivotal moment in time when we need transparency and understanding, and we have to make sure that all UFCW members have the facts about how these vaccines were developed. You deserve to know that these vaccines are safe, effective, and will be accessible to all of the essential workers in our union family. New research shows that African Americans make up only 9% of US vaccinations, despite the fact that we represent 14% of the total US population. I know that in our community, many are still hesitant about the vaccine, and that hesitancy is rooted in a complicated history with challenges to access safe, reliable healthcare. But we do not want that history to prevent our members from getting the life-saving COVID vaccine. Each of us will need to make our own individual decision regarding vaccination based on the best information available. We all know how important it is right now to be informed, and that is why we're here to help answer your questions about the vaccine. Today's UFCW virtual town hall event is an opportunity for you to hear directly from top health experts on the COVID-19 vaccine. Let's welcome our panel. Dr. Marcella Nunez Smith is a senior advisor for the White House COVID response team. Dr. Nunez Smith is also the director of the Center for Research Engagement at the Yale School of Medicine. Dr. Sherita Hill Golden is the Hugh P. McCormick Family Professor of Endocrinology and Metabolism and the Vice President and Chief Diversity Officer for Johns Hopkins Medicine. Ms. Tiffany Tate is the Executive Director of the Maryland Partnership for Prevention and is a commissioner on the Maryland Advisory Commission on Immunizations. To get things started, I'll now give each of our speakers the opportunity to say a few words, and then we'll answer some of the questions that you've submitted. First, I'm pleased to introduce Dr. Nunez Smith, who will discuss how the administration is centering equity in its pandemic response.
Thank you so much. It's just great to be here with all of you on this panel. Just thank you to UFCW, and let me just add that echo of appreciation for all the work this past year plus, and all the sacrifice, quite frankly. So I'm really just thrilled to be here in conversation tonight. I'm eager to get into the questions that are on people's minds. You know, from the beginning with the Biden-Harris administration, equity was at the center of the pandemic response. And tonight we're going to talk about vaccines, but I often say that's everything, right? Thinking about things like equitable access to PPE, so important. Making sure that everyone has access to testing and to therapies as well. And of course, as we are talking about tonight, equitable access to vaccines. Within the first 3 weeks of the new Biden-Harris administration, we stood up several direct federal vaccine allocation programs. So always intended to supplement and work in collaboration with states and local jurisdictions to make sure everyone could get vaccinated as they became eligible. And let me just quickly talk about those sites and share with you some of what we learned or were able to accomplish with those channels. People will be familiar with some of those larger mass vaccination centers. And from the very beginning, again, with equity at the center, took a very intentional approach, a place-based approach, thinking about the neighborhoods, the communities that had been hardest hit and were at highest risk, and located each and every one of those federally run mass vaccination centers in one of those communities. You know, as we talk in particular about communities of color tonight, what we see is that the vast majority, over about 60% of vaccinations delivered through those mass vaccination sites went to people of color. Many of those mass vaccination sites also had mobile units, meeting people where they are. So important. We're going to talk about that tonight, meeting people where they are in terms of information, meeting people where they are to make sure vaccination is easy and convenient. We also work still very closely with community health centers, tremendous assets in all of our communities. And for the community health centers across the country who are partners with us in this work, we similarly see closer to 70% of people receiving vaccinations through the community health centers identify as people of color. And then our retail pharmacy program, over 40,000 retail pharmacies in the country now. And from the beginning said, we need to make sure these are in important neighborhoods where people have been most affected. And in the past few weeks, we see around 50% of vaccines from the pharmacy program going to people of color. At this moment, 20,000 of those pharmacies are offering walk-up availability, so no appointment necessary. Some of these barriers we have to talk about and overcome. So really important in terms of the federal vaccination channels. We're shifting now, thinking about more pop-up, more mobile partnerships, again, to make sure that people are working with trusted and trustworthy community-based partners and others to be able to connect with vaccine. Much more work to do. And that's why conversations like this are so important. Just, that access to vaccine, but that access to information. We're in a war against misinformation, disinformation that is targeting many of our communities deliberately. And these are the opportunities that we have to set the record straight. I so appreciate what you said up top, because we're going to respect everybody who's still deliberating, respect the reasons why people have questions, right? This is a judgment-free zone here. Nobody is here to convince or to sell, right? We are here to share information and knowledge this evening and to learn, quite frankly. So thank you very much for this opportunity. Just great, great, great to be here again. Deeply appreciative for all the work, and from the administration, thank you for all you're doing.
Thank you. Next, I'm happy to introduce Dr. Golden, who will discuss safety and efficacy of the COVID-19 vaccine and who should receive it.
Yeah, so it's a pleasure for me to be here as well. And I also want to extend my thanks and gratitude to you for all that you do. And, in my role at Johns Hopkins Medicine as Vice President and Chief Diversity Officer, my team and I were certain to make sure it was not just the doctors and nurses who were considered essential frontline workers in our institution, but also all of our staff, our dietary staff, security, patient transport, everybody who was really in the trenches taking care of our units, keeping our hospitals safe. So we commend workers like you who have really been engaged as a part of that. And what I want to say is that while we're sort of beginning to see the light at the end of the tunnel, and now with about 50% of the adult U.S. population vaccinated, there's still, what I'm really struck by is that the population that is at risk for infections and deaths still have now shifted. So this time last year, we were talking about older individuals. Now we're talking about young adults and middle-aged individuals. Those are the individuals in our ICUs at Johns Hopkins Hospital and in our system. So I just point that out to say that young adult and middle-aged individuals are part of our essential workforce. They're people like you and others. And so that's why getting vaccinated is so critical to protect affect our future as we think about it. And, and so I think it's also important to point out, like, that half that aren't vaccinated, that is the reason why we still got to be our brother's keeper. And so if you are not vaccinated, nothing for you has changed, because you still need to wear a mask, you still need to physically distance, avoid large indoor gatherings. And even though I'm fully vaccinated, I'm still wearing a mask out in public because I want to protect those that I'm not certain about. And hand sanitizing, I think I'm never going to stop sanitizing my hands now, ever, even after COVID-19 is over. But I thought, what I wanted to share about the efficacy is, I will admit that as things were progressing with the vaccine development and how rapidly things were going, at first that gave me a little pause. I'm going to be transparent, but I had also seen so many of my own people die and experienced that myself personally. And so I spent my Thanksgiving reading everything I could about Operation Warp Speed, the efficacy of the vaccines and the trials. And what I will say is that for me, that information and taking that time to educate myself is what really pushed me to have confidence in what I read, that these were very large clinical trials. I looked at the enrollment. They enrolled people that looked like me. 10% in each of the Pfizer and Moderna trials were African American, and 19% in Johnson & Johnson. And we'll talk about that later on. And then I looked at the efficacy and the prevention of hospitalization, severe disease, and death. And then the other thing, of course, was the speed. But what I realized is that was an investment up front by the federal government, by other agencies and private industry, because people were dying at such a rapid rate that we had to invest those finances up front so that we could look at all the processes that we normally use in vaccine development could happen in parallel instead of in tandem, instead of one after the other. So as it looked good for phase 1, we could go to phase 2. As phase 2 looked good, we could go to phase 3. And so that's how we were able to get there. And then when I actually read, everybody talked about the new technology, and we'll talk about that. When I read about it, and I thought it was actually brilliant the way it was developed. And I was very excited to see that Dr. Kizzmekia Corbett was an African-American basic scientist who was behind the development of that at the NIH. So after that, I got myself there intellectually, but then I had to ask myself, well, what is my real why? And that's what I ask you to consider. And I'm going to show a picture of my parents who've been married for 67 years. They were blessed to turn 85 during the pandemic. And I feel like I spent a year keeping the two of them alive. And what I did not want to do was be the harbinger that brought something to them. So that I was, doctor, put your own oxygen mask on first. So that's sort of how I got there. So I just want to encourage you to think about what is your why. And then the last thing I'll say that it's really important, and Dr. Nunez Smith talked about this, is the education and access. And so once I learned that information, I started talking to anyone who would listen about the vaccines and answering their questions and addressing very well-founded concerns. I'm a diabetes doctor by training. I feel like I've become an immunologist, but I felt like it was really important for me to educate my community and others. And so a lot of like what we'll be talking about today, my team and I have done around Johns Hopkins Medicine. A lot of our Black and brown physicians educated our own employees. We've been educating our community. It was great that we had this computer sign up, but when we realized that was a barrier to our employees, I showed our executive leadership a slide of a rotary telephone. So can we just have people call and make an appointment? And so that's what we did. And then now we actually take the vaccines to the units. So just like we're taking them to senior housing in the churches, we take the vaccines directly to the units. So we can reach our food service workers, environmental services, everybody who's really too busy to come off the unit. So I just wanted to share a part of my personal journey with you, and happy to answer questions as we go along. So thank you.
Thank you. Finally, I'm pleased to introduce Ms. Tate, who will discuss her nonprofit's efforts to ease vaccination distribution and the importance of access for all populations. Ms. Tate.
Thank you. Thank you so much for having me. It's an honor to be here. And also, I just want to applaud your work, your interest, and your service. Like Dr. Nunez Smith mentioned earlier, you all are essential workers, and we couldn't have made it without you. And we really, really appreciate it. I just want to touch on some of the things that previous speakers have talked about. And one is this word that's thrown around a lot: disproportionate. And some people don't know what that means. And I think it's really important that we understand what disproportionate means. And so one of the earlier speakers, one of my colleagues on the panel, said that, we represent 14% of the population. However, we've been overrepresented in the number of people who have died from COVID, who know people who have died from COVID, who've been hospitalized because of COVID, who lost their jobs because of the quarantine and the society shutting down, who couldn't work from home. So when you think about 100 people lined up, only 14 people of color, or if we include other communities of the population, if you look at how many should be, and just in the general population, but how many were disproportionately impacted by all of these societal and medical and emotional and mental impacts from this terrible disease. I personally lost a close relative and 3 dear friends to COVID. And they were young. They weren't old people living in a long-term care facility. These were young people, some of them very, very healthy people. And I have a lot of friends who are not people of color, and hardly any of them know people who died from the disease. And if I would guess that every African-American, every Latinx person knows someone who got severely ill or who died. And so when we talk about the why are we doing this? We're protecting ourselves, we're protecting our communities, and we don't need to continue to be disadvantaged. We've had a lot of struggles, and like Lakita pointed out, we have a complicated history with healthcare. And so it is complicated, and I'm so glad that we've established this is not a judgment zone. We are here to talk about it, to give you as much information as possible so that then you can make informed decisions. And your why may be different. Your why may be, I'm going to get vaccinated because I don't want to miss work, because I don't get paid when I don't go to work. I don't want to get sick because I don't want my child to get sick because they've got to stay home and then I can't go to work. So there are a number of reasons why we should be getting vaccinated. I got vaccinated because I've worked in vaccinations and immunization my entire career. So I went to Johns Hopkins, where Dr. Golden is now, the School of Public Health, 100 years ago. And my first job out of graduate school was immunization. And I thought, boy, this is such a boring job. This is so boring. Nobody's getting sick. Why are we telling people to give their kids shots? There's no illness. And then the first time that we had an outbreak, I was like, this is the most amazing thing ever. And that was 27 years ago or something, or 23 years ago. And I've never left. And I've not left because it is the most important thing that you can do to protect yourself. And we work with flu vaccinations, children getting vaccinated to go to school, and now with this pandemic, this is a life-saving vaccine. A lot of times people have said they're repeating a lot of things that they hear on the internet, on Facebook. Social media is just spreading a lot of things. And like Lakita mentioned earlier, sometimes people are doing this, or I think Dr. Nunez Smith mentioned, people are giving this information for a number of reasons. Sometimes they're giving us this misinformation because they don't want us to be healthy. They don't want us to go to work. So we have to be seekers of information and truth, and then make informed decisions. So when I encounter friends, relatives, colleagues who say, I'm not getting my vaccine, does that make you angry? And I say, no, I just want to know why you're saying this. And so for those of you who are in a position where there are relatives or friends or colleagues who don't want to be vaccinated, just make sure that they have all the information. Like Dr. Golden said, over Thanksgiving, she went and got herself educated. And we don't know what she might have found something that said, oh, I'm not getting that shot. But now she's been educated and she made a decision. And that's what we have a responsibility to do. We have lost too many people. Our children are way, way behind in schools. When you look at children in the inner city and urban areas, the impact of this pandemic has been terrible on our community. So it's really important to make sure that you're educated, make an informed decision, make sure that the people around you understand the why, and then respect them if they make a decision to delay the vaccine. So I was so excited that this vaccine came so quickly, because I've worked in this field so long that it takes forever for a vaccine to be in development. And when I heard that they were hoping to have a vaccine within the year, I didn't think it was going to happen. And as soon as it happened, I was rejoicing. So I believe in this. Vaccines save lives. They're safe, they're effective. And I joke all the time because people will say, well, they're experimenting on Black people. And I say, well, just go to the white part of town and get your shot. If you think they're giving us the bad vaccine, go to the other side of town and get vaccinated. But this is in the best interest of all of us, just to be informed and be prepared. And the last thing I'll say, and I think I may be answering this in one of the questions, but I can't say it enough. You have been hearing a lot about people getting sick from the vaccine. And what's really important for people to understand is that you're supposed to, that's your body telling you that the vaccine is working. So when the vaccine introduces a little bit of the virus in your body, and that is your immune response. So anytime you feel yourself coming down with a cold, that's your body saying, uh-oh, something's in here that's not supposed to be here. I'm going to fight it. And so don't feel like I don't want to get the vaccine because I'm getting sick. You're not getting sick. It's a sign that your immune system recognizes that something is in your body that's not supposed to be there. It's new, and then it's developing an antibody. So it's developing fighters to fight that if it ever sees it again. So don't be discouraged. I got my shot and I got sick and I was rejoicing. And I went with a friend, and it took him my reaction came about 12 hours after I got vaccinated, and his came about 24 hours later. And I said, your old lazy immune system. I said, mine was like right on the case, and yours was like, what's that? Well, you go look. No, I went for last time, you go look. And mine sprang into action. So just be happy and plan for that, and know that you might have a reaction. It's normal. It's telling you that your body's working. So there's so many things that you're going to learn today that you've been misinformed about in the past. So that's why I'm really excited to be here with all of you. And thank you so much for this opportunity.
Thank you all. I am really grateful that our UFCW members have the opportunity to hear from experts like you who look like them about the COVID vaccine and what we can do to protect ourselves, our coworkers, and our families. Now I want to go into our question and answer discussion, where we'll get to hear from our members across the country who submitted so many great questions about the vaccine and how we can all stay safe. First, I'd like to ask everyone on the panel, which I think most of you guys covered it, if you've received the COVID-19 vaccine. I think it's unanimous. Okay. All right.
Yeah, I got the Johnson & Johnson one, so I got the one and done vaccination, but I think it'd be helpful if we all shared which vaccine we got and if we had any reactions.
Yeah, I got Pfizer. And so I think with the first shot, I had the arm pain the next day. Getting the shot itself was actually less painful than the flu shot for me. And because when she was, I was surprised that she was done. And then I had like arm pain and fatigue the next day. That went away. When I got my second shot, I actually got it on a Friday so I could plan, have the weekend. And by that afternoon, I was having chills, but sort of like Ms. Tate, I was like so excited to be having chills because that meant that my body was generating an immune response. So I took a couple of Tylenol, put on flannel pajamas and got in the bed. And the next day it was all resolved. Mm-hmm. And my husband had just fatigue when he got Pfizer. So that was my journey.
Let me tell you, this is a perfect triad because Team Moderna. And so, and to be real clear, when I went, I'm a practicing internal medicine physician too. And when I showed up at the hospital, they said, today we have Moderna. It's like, that's what's on the menu and that's what you're getting. And I think it's so important to talk about all the vaccines that are available, having been shown to work really, really well, have been given safely to millions and millions of people. But this is such important work to kind of talk about our vaccination stories. And so that first day too, that first time, I think, I had the sore arm as well. Like Dr. Golden said, it was a similar thing. It went in easier than the flu shot. And I think I was strutting a little bit when I went back for the second one and was like, oh yeah, I got this. And, as we know, we can anticipate, as you've just heard, right? And I too got mine on a Friday, kind of just to be safe. I spent 24 hours in bed, cozy, same. I had myalgia, some body aches, myalgias, some low-grade fever, some chills. So Tylenol and I were friendly, and water for 24 hours there, and then it was gone. And when I think about that experience and not knowing what it would be like to have gotten COVID-19 itself, I mean, the infection is SARS-CoV-2 is a very tricky virus because you just don't know. I hear people taking that gamble, right? And I'm like, you actually don't know. You heard Dr. Golden say who is in our hospitals now. So no one should think that, they are not gonna, it's gonna be so easy, it's gonna be fine. And so I said, listen, this was better than getting COVID-19 for sure. And so much better in terms of what is our social responsibility, right? Not just to ourselves, but thinking about our families and our community and all the people who cannot get vaccinated for health reasons and other things and keeping them safe. So the other perspective here from all the 3 vaccine teams, we just got to be honest and transparent about what that vaccine experience is. And certainly everyone's might be unique, but I'm sure we'll get into some of what people should anticipate and potentially expect when they get vaccinated.
All right, thank you. And for the record, I too took the Johnson & Johnson one and done. A little bit of Tylenol, but was great the next day. So yeah, we'll sign off on that. So, okay, now let's get to the questions, which are going to cover a variety of topics like how the COVID vaccines were created, how safe and effective the vaccine is, and what we need to do to make sure that essential workers everywhere have access to the vaccines for themselves and their families. So let's get things started with a question that was submitted by video. This question comes from one of our members, UFCW members, Terence from California.
Hello, my name is Terence Bacon. I'm a member of UFCW 1428, and I have a question for you. I heard that it's still possible to get COVID-19 after getting vaccinated. If this is true, what are the chances of that happening? And what is the purpose of still getting vaccinated?
Dr. Nunez Smith, can you respond?
Oh, absolutely. Yeah. And I'd certainly invite anybody else to add on, but great question, Terence. And can you get COVID-19 after getting the vaccination? So let me begin by saying, and we've thrown this term around a little bit tonight, but these vaccines, all 3 of them, highly effective. So what does that mean? That they're highly effective? It means it works. Now, what does it work to do? It works to keep people from getting seriously ill, getting hospitalized, or dying. So when I say it again, that's what we looked for in the trials that Dr. Golden referenced before. Keep you from getting seriously ill, hospitalized, or dying. That's vaccines working. What we saw in the clinical trials was the efficacy. That's kind of under the trial conditions. How well does it work? These are the numbers that you hear that are in the 80s and the 90%. For us, in this immunization space going in, we were optimistic and hopeful that we would get to efficacies 50 or 60%. And so ended up with signals in the clinical trials way beyond that. And now we see in real world settings, right, out and about, the effectiveness in real world settings that's holding, that the vaccines are working to keep people, again, out of that most dire consequence of COVID-19. So there are some instances, no vaccine has 100%, that we are so close with these, but not one out there is 100%. And so there are, in fact, some very, very uncommon, rare instances where people might get COVID-19 after getting vaccinated. Some key things to remember though, right? Again, most of these cases going to be asymptomatic. People don't even know that they've been infected, or very, very, very mild. We haven't talked perhaps enough about like surveillance systems. And so one of the things I think is important to know is that the federal government is definitely tracking to make sure if there's anything important people need to know, that we'd be ready to tell you. So the CDC and others are following this exact question to say, how common is this? And so far it's been extremely uncommon for anyone who's vaccinated to get a case of COVID-19 that results in hospitalization or death. So at the end of the day, all the science and the data and the evidence say getting the vaccine, COVID-19 vaccine, is going to be the best bet to keeping you, and of course everybody else around you, safe from the worst outcomes of COVID-19.
Okay.
I was just going to add, just to put in perspective, like the risk of what they call breakthrough infection. So you got the infection after, the vaccine. So remember, you're fully protected 2 weeks after, if you're getting a 2-shot regimen, you're fully protected 2 weeks after that second dose. With Johnson & Johnson, it's 4 weeks after your dose. And so you have like a 1 in 10,000 chance of getting COVID. And so for those of you who are baseball enthusiasts, like my husband and son, you may have heard about, I think it was on one of the baseball teams, that there were players that had been tested positive for COVID, but that was a part of their surveillance. Almost all of those were asymptomatic, as Dr. Nunez Smith mentioned. So just want to put it in perspective. It's like 0.01%, like really tiny numbers.
Okay. Thank you. I'm going to now move to our questions that have been submitted through email and text message. And Dr. Golden, this one I'm actually going to direct to you because we all just kind of touched on it a little bit. But if a member has already had COVID-19, do they need to get vaccinated? And what are the chances of them getting COVID-19 again? So a little different take on that.
Yes, so this is a really important question. So it is still recommended that you get vaccinated even if you've had COVID. And so, having had COVID, you do build up natural immunity, but it is possible to get infected with COVID again. Like, that response doesn't protect you from getting it subsequently. So we have been recommending that individuals who've had COVID still get the COVID-19 vaccine. Typically, we recommend waiting about 3 months after your COVID infection is resolved. And part of that is because of the side effects that we talked about earlier. So if you get your COVID vaccine close to having had COVID, it's almost like that first shot is almost like a second boost because you've had this natural immune boost. So you have more side effects potentially. So that's why we say wait the 3 months. And then the other thing is if you've been treated with something called monoclonal antibodies. So you had COVID and you got the treatment, the IV treatment with the antibodies. We wait 3 months till you get your COVID vaccine because those antibodies could interfere with the effectiveness of you mounting your immune response. So there is still a risk of getting COVID. And so that's why we recommend getting the vaccine anyway.
Okay. Anyone else want to weigh in?
I was just going to say, for Dr. I always say for this natural immunity, you heard Dr. Golden mention, we just don't know how long and how strong, right? And so at the end of the day, the vaccine, we are sure, because we have the clinical trial data, that it's going to be a strong reaction. You're going to build those antibodies and it's going to last you for a duration. So just get that vaccine. So important with all the caveats Dr. Golden mentioned in terms of timing.
Okay. Thank you. So our next question, Dr. Nunez Smith, I'm going to direct this one to you. The CDC recently updated their guidance saying that vaccinated people no longer need to wear masks indoors. This has resulted in many of our workplaces relaxing their mask guidance for customers and in some cases workers. What can our vaccinated and non-vaccinated members do to protect themselves at work when they now must worry about being exposed to unmasked and possibly unvaccinated customers?
Yeah, so the CDC did recently update their masking guidance. And what it essentially says is if you are fully vaccinated, remember what Dr. Golden said, it's at least, the 2 weeks after your final dose, that you have a choice now about wearing a mask when you are indoors. And so, that's an important consideration. There are many other things that the CDC said as well. And I think there will be additional and forthcoming guidance on this, because so much of this has to do with what's happening in your communities. So at the end of the day, the local jurisdiction is what you're going to look to for guidance, but of course, as well, for businesses and others and schools and travel and other implications. So there'll continue to be guidance around that. But to your point, we talked about PPE a little bit up top. And, this is where we look very much to employers for collaboration too. It is important that employers step up in this moment and prioritize the safety of employees And when we talk about that, we can get into this because part of that is making sure that employees can get vaccinated, right? Can get paid time off to get vaccinated. So that's not a barrier. You can even, as an employer, host vaccination clinics and sites right at the place of employment, just helping people connect with vaccine. Because what we do know, what the evidence says is if you're fully vaccinated, then your risks, again, are very, very low. And so the safest thing for employees is to be fully vaccinated themselves.
Okay, thank you. Ms. Tate, this next question, there's concern among our vaccine hesitant members that these vaccines were rushed through the approval process. You guys kind of touched on this before. They want to wait and see how more people react to the vaccine before getting it themselves. Can you address these concerns a little bit?
I think they're understandable, especially if you don't understand the science behind how it works. When I don't understand things, I defer to a trusted expert. So I'm not a scientist, I'm not a physician. So I would go to my doctor and say, what do you think? Did you get vaccinated? Did your children get vaccinated? Did your family members get vaccinated? And what was your deliberation process? So if I were Dr. Golden's patient, Dr. Golden would say, well, I studied this all Thanksgiving. I read everything I needed to know, because we can't continue to lean on our lack of understanding of things. If we don't know, we need to go to a trusted person and then get that information and then make decisions about it. So I can appreciate why people would be hesitant, because it seems like it's something new and untested, but it actually has been tested. It had an enormous response. People were very anxious to help with the development process. And so they participated in these clinical trials where the vaccine was tested on them, and scientists who are really, really smart and educated and experienced in this area were able to make these decisions and determinations. And then our government agencies, the FDA and the CDC and the ACI, these other groups have come together and said, these vaccines are safe. It's worth making this available now. Too many people are dying. Too many people are being sick. Too many children are missing school. Too many folks out of work. And they've been proven to be even more effective than we ever imagined. When you think about other vaccines that are on the market that you do give to your children and to yourselves, flu vaccinations, other vaccinations, these vaccines are more effective than those vaccinations that we're very familiar with. So we were thrilled with how effective they are. And I just would urge you, anytime you don't understand something, don't just dismiss it and say, well, I don't know, so I want to wait. Instead, go to people who are trusted and hear what they have to say, and then make a decision.
Okay, thank you.
If I might just, if I might, only just to Ms. Tate's point, we see 90% of physicians in the country have been vaccinated or intend to immediately get vaccinated. So back to kind of looking at what people are doing who have a good handle on the science and the information that's out there. So important.
Mm-hmm.
Yeah. To follow up on that, Dr. Nunez Smith, because we are getting a lot of questions about it, if you guys can talk a little bit more about the clinical trials. I know that I think Dr. Golden touched on it a little bit, but were they tested on a diverse group of people? Were people of color more or less likely to have a reaction to the vaccine?
Yeah, absolutely. So, yes, and I'll be brief here because I think Dr. Golden, did touch on this earlier, but it is such a good question. We should revisit it because I know one of the most common questions that I get is really, can people see themselves in the clinical trials and the research? And that's a fundamental question. So the answer there is yes. When we look at who participated in those late phase clinical trials, we see really great diversity, really great representation across communities of color, 30% across the studies, higher than that. And to these questions of subgroup analyses revealing anything different, the answer there is also no. I mean, so grateful, I think was mentioned also earlier, 2 of those clinical trial participants who stepped up. I won't miss an opportunity to say that we all should be thinking about how we can contribute to advancing science and participating in research and clinical research. It's so important for moments like this, so we can say yes, that there was representation there. And importantly, representation in the scientists who developed it. You heard about Dr. Kizzy Corbett, There is representation in the policymakers and the scientists who reviewed all the evidence and made the recommendations and the decisions. You have people like Dr. Hildreth who've been part of those processes all along the way. So, no steps were skipped whatsoever in this, from the beginning to the end. But it's so important for people to know representation in the trial participants, but also in the scientists and the policymakers as well.
Mhm.
All right, thank you. Dr. Golden, can you explain the differences between the vaccines and how they work? That's been
Sure. So the Moderna and the Pfizer vaccines use the same technology. So that's the mRNA technology that you may have heard about. And so basically the way to think about what mRNA does, like if you sort of want to remodel a kitchen, you have like your sort of blueprint of all the things that you want that to look like, but you got to go from the blueprint to actually putting in like countertops and cabinets and all of these things, right? So if we think about it, like our DNA and the nucleus of our cell is like, that's the blueprint, but what translates our blueprint is what's called our mRNA. And so what they did is with the virus, the virus is called corona because corona in Greek means like crown. And so those little spikes that you see sticking up on it, that's called the spike protein, makes it look like it has a crown. And so what they did was to take the mRNA that makes that spike protein, so not the whole virus, just a spike protein, and they package that so that that mRNA is what's injected. And then what it does in your cell is it causes your cell says, oh, this is mRNA to make a spike protein. So your cell starts making the spike protein, but then your other cells that make the antibodies come along and they're like, wait a second, Sherita doesn't have a spike protein. What's that doing there? And so it creates these antibodies that will sort of attack that spike protein. And so after the mRNA sort of makes the spike protein, the mRNA gets degraded, just like all mRNA in our cells. But then we have this memory, right? And so the next time your body sees a coronavirus, it's going to say, wait, this doesn't look like Sherita, and it's going to generate those antibodies and kill the coronavirus. So that's sort of what the mRNA technology does. And I will point out, you've heard the term, it's a new technology. And in fact, it's been developed over about 9 to 10 years. It's been developed over a decade, and specifically to be able to respond to a infectious disease pandemic like this, to be able to quickly create a vaccine. So that's something important. So this is the first time we've been able to use it, but it's not that it's just completely brand new technology. And then the Johnson & Johnson vaccine uses maybe what we consider a more traditional vaccine approach, where it's actually taking the spike protein and putting it in sort of an attenuated viral vector. You get injected, and then that stimulates your body. It sees that protein, and it's like, oh, don't recognize this. It makes the antibodies. So it's just a different way of having your body make the antibodies. So that's sort of the difference in how they work. But the end result is the same. You're making antibodies to that spike protein. And the next time your body sees that spike protein, it's going to know it's not supposed to be there and attack the virus.
okay.
And they do not alter your DNA.
They do not, right.
Okay.
So I want to make the point. mRNA only translates, it does not go into your nucleus. So, some people have joked afterwards, they're like, see, I still have the same numbers of fingers and toes and everything. So we can't create anything new. It is just creating just enough and not generating the entire coronavirus, just the protein, just enough to generate your body to make an immune response. So that's what I thought was so brilliant about it when I read it, it's a teeny amount, but it causes this robust response that protects you.
Okay. Thank you both. So Dr. Nunez-Smith, I'm going to direct this one to you because you spoke about reducing barriers to vaccination, which is something many of our members face.
Yes.
So can you explain what some of those barriers are? I know we kind of touched on it earlier, but what some of those barriers are and how the government can work to overcome them.
Yeah, no, thank you for that question, because that's where we are now. We're in a new phase of the vaccination campaign nationally. We heard earlier that there is a lot to be optimistic and hopeful about. We do have, 50% of the adults in the country who are vaccinated, but we still know that there are people who are at yes or close to yes and haven't gotten connected with vaccination because of some of these exact barriers you're talking about. So our commitment is definitely there to address them, again, to work through these various partnerships. If you think about even something like transportation, that might be a barrier for some people. So we have a partnership with Uber and Lyft. They've donated rides between now and July 4th to be able to take people to and from vaccination. That's so important. But we know there are 25% of people in the country who don't have smartphones. And so we're also thinking through transportation solutions there. You know, I highlighted before paid time off. This is very important. We sat here and we talked about the need to have the time to go get vaccinated, and you might need a day or two, right? And some people, it's unpredictable. Some people will not need it at all. Some people might need it after the first shot. You know, some people might need it after the second, but people need to know that they have that paid time off. You know, President Biden has made available through the American Rescue Plan a tax credit for small and medium-sized businesses. I want everybody here to know that, because small and medium-sized businesses can get a tax credit for giving employees time off, not just to get vaccinated, but to recover from side effects if needed. And the president has called upon large employers to offer paid time off as well. So that's critical. But we also hear about other things too. We know this has to be easy, it has to be convenient. And so there's a lot of confusion out there about, you know, do you need to pay? Is there anything that is going to be out of pocket cost? The vaccines are free, no out of pocket cost to you whatsoever. There's confusion about, like, you know, do you need to bring insurance? You do not need insurance. And you do not need proof of insurance in order to get vaccinated. You do not need a government issued ID to get vaccinated. We are not looking or interested in checking on documentation status to get vaccinated. So none of that is out there, but we really want to be careful and attentive and intentional that we're paying attention. You know, what are the needs that people have that might be keeping them from connecting? Registration was a big problem for folks. So getting rid of the registration barrier. I mentioned 20,000 pharmacies, you just walk right up. Let me just make sure everybody has this information too, because right now you can text your zip code to get vax, right? Or to vacuna, right? And you will get back 3 places close to you that have vaccine, right? And we will ask you if you need transportation help to get connected with vaccine, or you could go to vaccines.gov. So making it really easy for people to get connected with vaccine is so important. And we're continuing to think and make sure that we are removing any of the barriers that might be standing in the way, again, of people who, you know, who are at yes and just need that opportunity to get connected with vaccination.
Okay, thank you. So our next question is a video question, and it comes from Vernica, a UFCW member from Alabama.
Hi, I was wondering if it was safe to take the vaccine if you have things like any immunosuppressant diseases like rheumatoid arthritis or lupus, or other things like Alzheimer's disease or dementia. Are there any adverse reactions or side effects? Would it have any triggers from the vaccine, or is it safe to take? Thank you.
Dr. Golden, can you respond? Because I think this kind of goes to the diabetes and all other kinds of, yeah.
Yes. So one of the things I think is important to remember is that in the trials, when we think about who was in them, there were people in the trials who had chronic diseases, because we knew that they were really important risk factors for poor outcomes from COVID. So patients with diabetes, patients with some of the conditions that were mentioned in the video, like rheumatoid arthritis, lupus. So people with hypertension, heart disease, lung disease. And so the vaccine was effective in those individuals. Now, the one thing I will say, though, is one of the things that we have come to learn is that for patients who have had organ transplants, who are on very, very high doses of immunosuppressants to prevent organ rejection, that they are not mounting as strong of an immune response to the COVID vaccine as someone who's not on those medications. So that's important to know for 2 reasons: that for them to continue masking, particularly, in settings where they're around other people to protect themselves, but it's not a reason not to get the vaccine. It's just to know that the immune response, if you've had an organ transplant, may not be as strong. But we don't have reason to believe that if you have other chronic health conditions that it's going to either not be as effective or cause any excess side effects. And in fact, elderly patients have been tolerating the vaccine very well. So I think that's another important consideration.
All right. And actually, I'm going to stick with you. I'm going to direct this next one to you too. Many people who work in our core industries, and that's grocery, retail, meat packing, and processing, face scheduling issues that make it difficult to schedule one shot, let alone two. Can you explain why both shots are important? I know you said it was kind of a ramp up, but I think it's worth eating a little bit. So can you address that?
Yeah, so one of the nice things about the studies is that we were able to look at and track the antibody response. And so we know that you sort of get maybe about halfway there with the first shot. It takes that second shot to get you're fully immune protected, to get the full boost. And so that is the reason that a second shot is required for the mRNA vaccines. With Johnson & Johnson, you get the full dose, the one and done, as we've heard. So one of the things to think about is, and I know for some of our own employees, we were initially only offering Pfizer and Moderna because that's what was first available. But for some people, if the scheduling is an issue, that may be a consideration in you deciding to get the one shot instead of one that requires two shots. And so I think that's something to think about, but we'll also reemphasize what Dr. Nunez Smith said, that particularly for large organizations, like ours at Johns Hopkins Medicine, we did a lot, two days of PTO if needed, but we actually did not require the use of PTO to get the vaccine because we offered it on site. You could have the 1 hour or 2 hours off, whatever was needed. We tried to offer it multiple sites across our system so that there wasn't driving from one site to another. So I do think that that is important for the partnership of sort of the employees with their employers to try to remove some of those barriers related to time and scheduling.
Okay. Ms. Tate, I'm going to direct this one to you. There are a lot of rumors still flying around about the vaccine, including that it's being used by the government to track people. Can you address those rumors, and what can our members say to convince friends and families that these rumors aren't true?
Well, the vaccine does not have any ingredients that would allow the government or anyone else to track them. However, the government is already tracking us. The government tracks us through our social security number. They can track us down through our cell phone, pinging wherever we are. They can track us through social media. Cameras are everywhere. People have cell phones that are, so if you're going to be paranoid, you would be paranoid just about walking around in your everyday life, because there's a lot of information available to people. So the government is not, the vaccine manufacturers, the people who made these products did not put any ingredient. There is no ingredient in there that could allow someone to be tracked anywhere. But we need, if we're concerned about that, we also need to be mindful about the information that we make available about ourselves in everyday life. But there's just no mechanism. There's no way to be able to inject someone with something and then have a device that's able to track your every move. But again, it's about education and finding a trusted, reliable source that who knows about this vaccine and who knows about medicine and science, and ask them if they got vaccinated, what their reaction is to these types of rumors. But they're exactly what you said. They're rumors, they're unfounded. And when you listen to them and you make decisions not to be vaccinated, it can lead to severe illness. It can lead to death. You could miss time from work. You can miss time from school. So it's just so important to educate yourself about whatever is being said.
Thank you. I'm going to now go to Dr. Golden. We've got a question that says, can women who are pregnant or are trying to become pregnant take the vaccine? And related to that, have there been any studies on the vaccine's impact on fertility?
So women who are, so one of the things that I thought was interesting is in the clinical trials, there were women who got pregnant while they were in the clinical trial. So just would like to point that out. So even though they were participating in the clinical trial, got vaccinated, they were able to get pregnant. The vaccine has not specifically been tested during pregnancy. I will also share, though, that pregnant women who have contracted COVID-19, many of them do very poorly. And so we recommend, many women have chosen to get the COVID-19 vaccine during pregnancy for that reason. So some of my physician colleagues at Hopkins who were pregnant chose to get the COVID vaccine for that reason. The other thing is that there are recent data that show that the mom's immune response to the COVID vaccine, that passive immunity gets passed on to the baby. So the baby is protected for a few months until the mom's immunity wears off. So there may be some protection in that newborn period. So I think that's an important consideration. There have not been any data to support any concerns around infertility related to the vaccines. And I know that that has been a concern, but there are no data to support that that's an issue.
Okay. Let's see, moving on to the next question. Ms. Tate, will we need to get boosters after getting vaccinated? And what are boosters and how do they work?
So a booster is basically, we've talked about immunity and our body waging an immune response to the vaccine. So once we've developed that response, it can wane over time. It can lessen over time. And so a booster just reminds your body, hey, remember this disease? Remember what this looked like? And then your body then boosts its immune system. Your immune system gets a boost so that it can now react to this virus that had been introduced months ago or years ago. And so it varies with the type of vaccine that you get. So if you think about some of your childhood vaccinations, like chickenpox vaccine or a pertussis vaccination, there's a different period of time that they recommend. It might be 10 years later, it might be 5 years later, it might be 2 months later. So with the COVID vaccination, I know that information is still coming out, but the manufacturers are saying you will need a booster. And it just matters. It just depends on the vaccine that you got and when you need that booster.
Okay. Our next question, Dr. Nunez Smith, how safe is the vaccine for minors ages 12 to 16? And how soon do we expect the vaccine to be available for children younger than 12?
Yeah, so great, especially here we're getting into summer and summer camp season and getting ready for next school year. It's a great question. So, not that long ago, now it's just a couple of weeks ago, we saw authorization for the Pfizer vaccine. So we've been talking about 3 vaccines this evening. I just want to make sure everybody is aware that it is the Pfizer vaccine that is approved for those who are 12 to 18 years old in this country. And so it is, again, clinical trials. So those clinical trials have been ongoing. The FDA, the CDC advisory group that Ms. Tate referenced earlier, ACIP, they all reviewed the data from the clinical trials for those adolescents and found, in fact, in the data, we were looking at 100%. There were no cases of COVID-19 of concern in that group. So the data were very, very strong from the clinical trial for those young folks. What we expect, of course, is to see, Moderna has announced that they too have data in that young group that they'll be submitting and requesting authorization for as well. And the clinical trials are also ongoing for those younger groups. So a lot of this has to do with, making sure that the dose is correct. Do we need a dose de-escalation, right? Things like that. So, but those questions are underway. And I know a lot of people who've actually eagerly signed up their children to be part of those clinical trials. But again, no steps are ever skipped. So once those clinical trials have been concluded in those younger ages and has been submitted, it'll go through that same review process. So the timeline, for younger children, we might be looking towards the end of the calendar year, even a little bit later to get kind of all those data in. But, it's really great that we have that option for the 12 and up now in the country.
And may I add to what Dr. Nunez has said? We say that children are really efficient vectors for the vaccine, for illness. And so they interact with their siblings who are around their same age. They interact with their parents. They interact with grandparents. And so there is an age group that can touch so many different generations. And so some people might think, well, maybe I don't need to vaccinate my child, because kids haven't gotten really sick from the virus. There have been children who've gotten very, very ill and have died, but also they can have a mild case and give it to someone whose immune system is not as strong as theirs, or who may not be protected for whatever reason, and then they can cause illness and death in the community. So when we talked earlier about taking care of yourself, taking care of other people around you, why are you doing this? We're all going to do better when everybody who can be vaccinated is vaccinated. And just think, even though these children aren't getting severe cases as often as older people, they're still getting sick, and they can transmit it to other people who can get really, really sick.
Thank you. Okay, I know that we're approaching, we've got a lot of great questions, but I'm gonna ask now, if you guys would like to offer any final remarks. We can kind of start in order. Dr. Golden, we can start with you and work our way.
I just want to say that I hope that this has really helped to answer some of your questions and give you the information that you need. And I think, my final 2 points I would want to leave you with, I think many of us, particularly in the Black community, have some concerns about the experiences that we've had in the healthcare system and with research over the years. But at the same time, I just want to emphasize that if you get sick with COVID and you're severely ill and can't breathe, you're going to end up going to the very place that you have your trust concerns about and ask them to save your life. Mm-hmm. And so really, it is better to be on the prevention side of that experience with the healthcare system and not on the treatment side. And one of my mentees, I love the saying of his, and he's an ICU doctor. He said, the doctors and nurses in our hospital is your last defense. Your first defense is to prevent COVID. So we've got the vaccines and we've got our public health practices. And I say all of that to you to say that I have a very close friend of mine that died 2 months ago from COVID-19, who would have been 53 this weekend. Mm-hmm. And because his age group was not eligible in our state yet for the vaccine was the reason he had not gotten vaccinated. So we were like, if it had been a month later, it would have been a totally different scenario. So I say that to say that it's a younger group that's being impacted, and we need to take this seriously. It's not just those who with chronic health conditions who are older. It's even happening to the healthy. So I just share that personally, just to help you think about, again, protecting yourself, being on the prevention side of COVID and your interaction with the healthcare system and not on the treatment side.
Thank you. Ms. Tate, we'll go to you next.
I just think back to who we are as a people. We take care of each other. We look out for each other. We love each other. I don't know of any relative who hasn't had, I don't know of any person of color who hasn't had a relative sleeping on their sofa, who's been down on their luck, who they've welcomed in with their open arms. And this is just another way for us to take care of each other. So it's a different way of thinking about it. But if you take care of yourself and you encourage everyone around you, it's just consistent with who we are as a people, taking care of each other.
All right, thank you. Dr. Nunez Smith, we'll let you close it out.
Oh, thank you. I mean, what a gift it has been to be in conversation with all of you this evening. I too think I just want to say 2 things and very much echo what was said before. The first is, as we think about kind of why some people, do feel as though these institutions have earned their distrust, and they have, it's because over time, and we don't have to look that far away, people, African Americans, people of color have been kept away from scientific discovery, haven't been able to benefit from scientific knowledge. And here we have this opportunity where we can. I mean, the fact that we have these vaccines, this is amazing. This is amazing science. So we need to not deny ourselves the opportunity to benefit from scientific discovery. And the kind of the last thing I would say is, and kind of ask each person here, as you get vaccinated, please share your own vaccination story. We know at the end of the day, this is so much about talking to our neighbors, talking to our friends, hearing from them, the why, as it's been mentioned. Why did you get, what was your motivation? Why did you get vaccinated? And what was your experience like? So don't be shy. After you get vaccinated, be sure to talk about it. And everybody, of course, please be well and be safe over this upcoming holiday weekend.
Yes, thank you. So I want to thank all of our members out there who are joining us this evening. And I want to do a special thank you to our experts for sharing great information and helping our UFCW members and the broader community to get the facts that they need as we work to make sure all of our essential workers and their families can access the vaccine and stay safe. So we look forward to continuing to having ongoing communications and dialogue about this important issue. And with that, we will close it out and I will say be well. Thank you.
Thank you.